Hi once again. We now continue with the part 2 of the step-by-step trauma patient assessment. In this particular video, you go into the secondary assessment of the victim. So in the previous part 1 video, we ended at history taking and then baseline vitals. So we begin with the secondary assessment. Now, the caution behind secondary assessment is that if your patient is not stable, do not proceed with secondary assessment at the scene. Quickly load the patient into your trolley, load into the ambulance, and then on the way to the receiving trauma center, you proceed with your secondary assessment. But if your patient is stable and also can warrant your secondary assessment at the scene, you can do so. So let's begin with the secondary assessment. And in conducting the secondary assessment, we use the acronym DCAP-BTLS. So the meaning of the DCAP-BTLS means D stands for deformities, C for contusions, A for abrasions, P for punctures or penetrations, B for burns, T for tenderness, L for laceration, and then S for swelling. So it's going to cut across from head to toe and then posterior. So we first begin with the head. So you palpate, you check for any evidence of bleeding, palpate the scalp, assess the facial, if there is a maxillofacial injury, you check for the ears. So if you have a pen light, you check whether there is any CSF leak, cerebrospinal fluid leak. How do you determine a CSF leak? So you can get a gauze pack and then place this under the ear. So you get a gauze pack. So you place it under the ear, then allow a blood to drop. As it drops, you wait for it to dry. When it dries, if there is evidence of CSF leak, cerebrospinal fluid leak, you realize that there will be clear fluid circulating around a blood. So it gives an evidence of a CSF leak. They also come to the eyes. In the ears, you're also looking for any bruises behind the ears, which we normally call it as the battle sign. So you come to the eyes. In the eyes, you also be looking for any deformity to the eyes. You also be looking at periorbital swelling. You are looking for any raccoon eye, meaning there is any bruises around the eye. Then you come to the nose, whether there is a deformed nose. You also check for bleeding from the nose. You come to the mouth. You open the airway. You look for any broken teeth. You look for any deformities to the mouth. When you are done, you come to the neck. In the neck, still with the DCAP-BTLS, you assess under the neck, you palpate, you are checking for crepitus too. You come here now, you look for any tracheal deviation. Remember, we are dealing with a gunshot wound to the left upper chest. So there will be a sucking chest wound, and then which can proceed to either a pneumothorax or, in a serious condition, tension pneumothorax. So we'll be looking at any deviation of the trachea. Then we're also looking at any distended jugular vein. Now, after you assess that, you need to apply a rigid-sized cervical collar. So you open, and then you get it in shape. Then you need to measure. So you come, then you measure. So we have 4 fingers. 4 fingers mean this finger is able to fall under the chin of the victim. And then you apply the C color. So you slide it. Remember, my imaginary second rescuer is still maintaining the head and neck at the inline position. So I slide it under without lifting the head. And then we put it this way. And then we hold it. So my partner will maintain manual stabilization of the head and neck, so the patient is fully mobilized onto the spine board. When we are done, we assess the thorax. So we start with the clavicle, whether there is deformity to the clavicle. We start with the sternum. We are checking whether there is a fractured sternum. We assess for symmetry, whether there is equal chest and also assess for any paradoxical breathing, meaning that if there is a flayed chest, meaning there is a detachment of the rib from the sternum, one chest will be rising and whilst the other chest will be falling when the patient breathes. Then you also auscultate for breath sounds. So you get your stethoscope. You auscultate apex. Apex, you come to the medial, come to base, When you are done, you also make sure you check the chest seal you apply on the sucking chest wound is still intact. Then you move on to the abdomen. In the abdomen, you still with the decap BTLS. You also check whether there is any eviscerations. You also check for rigidity and then distension. You are also, after the decap BTLS to the abdomen, you are also assessing whether the abdomen is what? Rigid or is distended. When you are done, you come to what? The pelvis. So in the pelvis, you make sure you are checking whether there is deformity. As well, we are using the decap BTLS, and the decap BTLS cut across all the body parts. So you press it inward this way, checking for any possible deformity, and then press it slightly. You don't press it too much. And then in male, you are checking for priapism. So you slide it this way. And then in female, you are checking or looking for any sign of what? Hemorrhage. When you are done, you begin with the extremities, starting with the lower extremity where you are. So you palpate for any deformities, decap BTLS. When you get here, you check for distal pulse, and as well your patient is unconscious, but you need to also check for motor and then sensation. Then come to the other extremity, and remember, do not walk over your casualty. So you walk around, come to this side, checking for decap BTLS, check for distal pulse, check for motor and then sensory. Come to this side, still with the decap BTLS, you check for pulse, motor and then sensory. Move to the other upper extremity, still with the decap BTLS. When you get to the radial, you check for pulse, and then you check for motor and then sensory. When we are done, this is where we are now going to assess the posterior. In assessing the posterior, we log roll the patient onto the right side or the left side. Now remember, in the scenario, we stated the patient has a gunshot wound to the what? Left upper chest, and then a deformity to the left lower tibia and fibula. So we will not log roll the patient to the left side, but rather to the right side. So this way, I'll rather come this way, and then I make sure my partner, my imaginary partner, who is maintaining the head and neck in the neutral position, will give the command. I also have my other partner, so I hold the patient this way, move to the knee of the patient. My other partner will cross, get to the pelvic of the patient, hold the ankle side, make sure the legs are closer, and then by the count of the one holding the head and neck in the neutral position, so we go 1, 2, 3. So we go, and then this is where we are going to assess the posterior. So with the decap BTLS, you assess from here, you assess whether there is a deformity to the spine. You also look for any rectal bleeding, any sign of major bleeding at this side. Now, realize that we stated a gunshot wound to the left upper chest, and we sealed with a 3-sided occlusive dressing. So we should also look for any possible exit wound. If there is an exit wound, now we are not going to apply a 3-sided occlusive dressing, but we are going to seal all 4 sides. So we seal all the 4 sides, then we get a long spine board, and then by the command of the other rescuer maintaining head and neck in the neutral position, we count 1, 2, 3, and then we place the patient back onto the spine board. When we are done, we make sure we mobilize the head using the head blocks. Strap the patient with the spider strap. Make sure the patient is fully mobilized onto the spine board, and then we move to the receiving facility. So this is the step-by-step trauma patient assessment. Thank you very much.